Welcome, Adam. Welcome, everyone. This is our very first Ginger Desk webinar fireside chat. I am so honored and so thrilled to be joined by Adam Glendye today. He is the founder and CEO of The Pursuit Counseling, where he guides clients on a path of self-discovery, healing, and growth. He's known to those close to him as the sex, drugs, and rock and roll therapist. And you can bet that I'm going to be diving into that later to hear the whole story. And Adam has a calm yet candid approach that deeply resonates with clients from all walks of life, including those in non-traditional careers, the creative arts, and those navigating addiction recovery and sexual health. As a narrative therapist, Adam helps clients explore and reshape the stories that have influenced their lives. He believes that healing is a journey, not a race, and that every person has the potential to break through their current challenges and uncover a stronger, more grounded self. Adam has training in EMDR and a trauma-informed perspective. He works with high-performing individuals who may look successful on the outside, yet carry hidden burdens or unprocessed pain. I love this, Adam. Through his warm and whole self approach, he helps clients regain a sense of clarity, resilience, and meaning. Adam's philosophy is simple. If you trust me with your time, I'll spend it wisely. This guiding principle drives his work, ensuring that each session is an opportunity for meaningful, focused support. Outside the office, Adam lives in Fayetteville, Georgia, in the community of Trilith with his wife, Katie Bell Glendye. And they share a home with a rescue dog from Bolivia that they lovingly call Fonzie. Adam is so committed to giving back. He's been active in the Rotary Club of Peachtree City since 2014 and served as the president there in 2021 and 2022. He's also worked with the Fayette County Accountability Courts, supporting justice initiatives that foster growth and second chances. Adam and his clinic, The Pursuit Counseling, also happen to be clients here at Ginger Desk. So I've had the absolute honor to get to know Adam professionally over these past several months of working together. Our team here at Ginger Desk runs the front desk at The Pursuit Counseling with our VA support. And we have recently also launched live phone answering through Ginger Phone with Adam's clinics. And Adam was one of our initial launch clients. And I have a very big space in my heart for you, Adam, and for your company. And I'm so excited for our conversation today. So welcome, Adam, and thank you so much for being here.
Yeah, thank you. I'm excited to be having this fireside chat. It's kind of, 77 degrees here, so the fire's keeping me warm.
That's so great. We need it. It's a lot colder here, actually. So let's dive in. Now, this is the first time we've ever done a format like this on a Ginger Desk webinar series, and I'm really excited about it. It's a very casual conversation between you and me, Adam. And then we've got lots of folks joining us here. As I mentioned, we've got lots of folks actually from Team Ginger Desk because Adam has a bit of a fan base here at our company. And so as we go along, folks, feel free to let us know where you're calling from in the chat. And then please feel free to ask questions, comments in the chat. We will reserve some time at the end for Q&A if we can't get to your questions as we go. So I'm just going to jump right into the deep end here. So our team tells me, Adam, that you have this deep passion for your work. And I've heard so many stories about your generous nature and that you love giving back to your community and you just because you love your work so much. So I would just love for you to go back to the start and tell us, how did you get into the field of mental health? How did you first develop your passion for this healthcare?
Yeah, so it goes back to college. When I was an undergrad, I was a sociology major, and to be really honest, I had no idea what I wanted to do, but I just knew that people and groups of people were fascinating. They were interesting. I was an athlete growing up. I was a musician. And so just being around different groups of people was just really inspiring to me. And so the chair to our department happened to be a double doctorate in sociology and in marriage and family therapy. And so during my junior and senior years, I spent a lot of time in Dr. Floyd's office. And Dr. Floyd spent a lot of time helping me figure out what was important to me, got to know how I was wired, and just how I ask questions in his classes, and talking with other professors about about me, and I don't know why, because I'm not that interesting, but for some reason people were talking about me, and so they said, we want to see you be successful, and we think that you might be a good therapist. And I said, well, a physical therapist, I really am not interested in being a physical therapist. And they said, no, a counselor, a therapist. And I said, well, what's that? So he said, well, we actually have a free clinic at the university. Why don't you go and make an appointment there? And I said, well, I don't feel like I have anything wrong with me. So, the gateway drug to becoming a therapist is getting your own therapy. And
I love
so,
it.
so I realized that I didn't have to have anything wrong with me to ask for support, and that I could be helped to be even better, be healthier than I already was, and then for me to learn how to get out of my own way. So that's how I became interested in mental health.
Amazing. And it's such a young age. Like you were only just in
Yeah,
university.
right.
That's amazing. That's awesome. And so did you go straight into counseling right from undergrad?
Yeah, so I went, and in the States you have to get your master's degree. So I went and pursued my master's degree and did that in marriage and family therapy, and then I have a specialization in sex therapy. And so I have a certificate from the program there. So I spent 3 years in that program and getting the specialization. I did my internship at Savannah College of Art and Design, SCAD. And that's where I got started.
Amazing. And did you know at that point, like early on, you were going to school for this? Did you know that you would want to be a clinic owner, or did you have a sense of how big and how much you would scale at that point?
Yeah, so my initial hope was working with university students, but every interesting case that I came across, our supervisor said, well, you need to refer that one out. And so they were wanting to keep the basic anxiety, depression, and as a deep thinker, complex thinker, the cases that excited me were ones that I had to refer out. And so actually a professor
Interesting.
of mine, she was starting a private practice, and she said, hey, do you want to help me with this? And so I was able to refer the clients from the university to myself at the new private practice. So I
Awesome.
got to keep seeing them.
Oh, that's amazing. So you kind of hustled early on. Like you definitely saw something and you really tried to make fill the gaps there. That's
Right.
great. That's amazing. We don't see that so often. Like so often I hear that practitioners don't quite find their um they don't quite find their future until they have maybe a trauma themselves, or so it's interesting that it kind of found you like so early on in an academic way.
Yeah, well, to back up way even more than that, I have a very storied medical history. The airplane view, I was born with my intestines tied in a knot, had surgery at 6 days old, spent a month or so in the hospital, had to have the same procedure done at 6 years old, and then another month in the hospital, and then again my freshman year of high school. And so I have a lot of medical trauma. And so that's some of my foundation of why people are interesting to me, and how everybody has a unique story, because visually, if someone looks at me, they don't see the medical trauma, because it's one of those invisible injuries unless I'm happen to be on the beach. But just in general, like everybody has a story, and that's what makes people special.
That's so fascinating. Thank you for sharing that, because you're absolutely right. And I think you mentioned that, to us earlier, that you can't always see the trauma in people. Of course we can't, right?
Mhm.
And I think as lay people, we don't necessarily know that there's always something deeper, but you as an experienced therapist, you know that now firsthand, that
Mhm.
even the wisest and most together of people might have something that they're,
Mhm.
harboring. That's Thank you for sharing that. That's really cool.
Oh, you're welcome.
No, so in terms of so you graduated, you've launched this incredible practice. Now, I know now that you run this very successful practice, the Pursuit
Mhm.
Counseling. So how
Mhm.
did you go from there to the Pursuit? What was it
Yeah.
along the way that you knew that you had to learn and that you took from those experiences to then launch your own clinic, your own successful clinic?
Yeah, of course. So the professor that said, "Hey, like I'm starting this. I want you to be a part of it." It was such a blessing to have somebody that saw potential in me and wanted to carry me along for the ride. And so we opened over the years 4 different locations. I think we ended up
Wow.
with around 50 therapists, a couple international contracts with different organizations,
Wow.
and I spent a lot of time running our intern program across locations. I was supervising, I think, 17 people at one time as their clinical supervisor, and I was running one of our on the ground locations, and carrying a full client load. And so for myself, I knew that systems were really important, and that was something that I struggled in the last practice to be able to get the systems I needed to be successful because I was spending more time on the phone and emails and trying to create stuff instead of doing the relationship building, spending time with the supervisees and in the community with my clients, where I just felt like I was always behind. So I knew
Mhm.
that when I had the opportunity to open up this practice, that systems were going to be the first thing that I invested in within the practice, systems from every way, shape, and form, because I wanted to get out of my own way.
Amazing. I love how you've said that because you kind of stole the words right from my mouth. You got stuck in the system so that you couldn't focus on your mentees, which is to me like that's your zone of genius, right? That's your
Right.
passion. That's why you're here. You're here to unleash the human spirit in others. And I totally see that in you. And that's what our team speaks so
Mhm.
highly of you for your ability to do what you do in such a magical way.
Mhm.
And so when you get lost in the details of just, the menial work or the tasks
Yeah.
themselves, you can't focus on that stuff that only you can do. So that's interesting. So what did you do? How did you solve for that when you launched the Pursuit Counseling? What did you do with those systems?
Yeah, so first was finding a great EHR. And so I needed something where everything was going to be in one place. At the previous practice, my bookmarks tab was, 85 links just to run the business day in and day out,
Spreadsheets.
within my sphere of responsibility. And I knew that I needed a good EHR. That was my first step. And then my second step was someone that was a lot more organized than me, because naturally my desk is just covered in papers that are all important, but they needed to be put together. And otherwise, I'm going to lose stuff. And I know that about myself, that's my like 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 creating the organizational system is one of my biggest growth areas as a leader. And so I knew that I needed to hire an organization that could help me create the systems or put together the systems to put together the vision. And so very quickly, I found out about Ginger Desk.
That's awesome. Thank you for the segue. That's so great.
Yeah.
And I find it hard to believe that your desk is a complete mess, but can we come back to that later?
Yes, we can.
That's
We
actually
can.
very interesting.
Yeah.
We do a
Yeah.
series here at Ginger Desk called Behind the Desk,
Uh-huh.
and it's where we actually interview practitioners and get them to send screenshots of their desk. So I find it always fascinating how the most brilliant geniuses
Uh-huh.
have these like sometimes disastrous workspaces. So I'm going to circle back to that, Adam.
Yeah.
So tell us about what it was when you decided you needed this person, you needed some sort of support and organization.
Yeah.
How did you decide to move toward a virtual or a remote support? What was the
Yeah.
thought process there outside of the company itself?
Yeah. So and we live in with 2024 right now. When I engaged with Ginger Desk, it was 2023, and so I'm not afraid of technology. And honestly, like I didn't want to pay someone 40 hours a week to be here to answer the phone that might ring 10 times a day, and then I'm paying someone to be sitting twiddling their thumbs for 40 plus minutes an hour. I just don't feel like that's honoring the person or honoring their time or honoring their skills. And financially it's important, but also like I want people to be happy with where they're working and the work that they're doing. And like I know for me, like if I have 40 minutes every hour where I have no purpose, then I'm
Yes.
not going to be fulfilled. So I'm projecting that onto other people, but I know that I wouldn't feel honored if I was getting paid to twiddle my thumbs for 40 minutes an hour.
You're absolutely right. And I mean, I love that you've said that because that's what I say about the joy of fractional support is
Yeah.
that it's so helpful for us because it's accessible and affordable as we scale, but it's also such a wonderful opportunity for these people to grow their careers and really thrive
Mhm.
doing work that they are so good at and that they love. So thank
Right.
you for recognizing that in our team. And that's probably one of the reasons why our team just adores you so much because
Mhm.
you have so much respect for what we do.
Mhm.
And I appreciate that. And
Yeah.
so in terms of Ginger Desk, then what made you come to us?
Yeah, so I was a Nicole McCants method course member, and for about 4 months in the program, I just kept hearing Ginger Desk, Ginger Desk, Ginger Desk, and so it was like the item on my list, and then I started asking, other people in my community, connected with other business leaders. I'm like, hey, like, do you have a virtual assistant? What are they? How many hours? What do you pay them? What do they do? Who are their other clients if they're virtual? And I just kept hearing, well, they work with me, but then they also work with the plumber, and then they also work with the home inspector, and then they work with the real estate professional. And I'm like, there's got to be someone that is trained in compassionate care. And so after hearing Nicole sing y'all's praises week after week, I was just like, all right, well, I need to book a discovery call because the one thing that was holding me back from hiring someone was like, I want someone that was going to treat my clients in the same way that a therapist would treat them because people call us because they've already talked to their friend, they've already talked to their family, they've already talked to their coworkers, and now they're saying, I've already asked everybody, like now I need professional help. And the first line of defense, Ginger Phone and Ginger Desk, I want them to be trained to be able to hold someone's story and be able to operate within the system. And you're not paying me to say this, but like this is what I found at Ginger that every assistant that I've worked with has been able to sit with a client where they are in their moment of distress.
Thank you, Adam.
Yeah.
That's really kind of you. And I'm
Mhm.
so happy to hear that you've had that experience with us and that we can provide that for you.
Mhm.
And so with that, what is it like? Let's say now you're so happy with Ginger Desk. Thank
Mhm.
you.
Yeah.
What do you do now that you don't have to work in the business, say at the front desk? You don't have to
Yeah.
manage turnover with staff that we know is such a big burden and pain point for clinic owners.
Mhm.
What is it that you're now able to focus on that is your zone of genius outside of direct patient care? What are some of the practice building activities that you enjoy?
Yeah. So my problem is I love it all. I'm just not great at everything. I learned a long time ago that like hire for your weaknesses and then also hire for people to make your zone of genius or zone of excellence even better. And so I just like to surround myself with people and organizations that are better than me. Um, so I spend a lot of time learning about business, learning the theories that my staff work from. I spend time researching so I can be a better supervisor for them. Um, we just did a training in EMDR together as a staff. So that was
Wow.
exciting to do, to have all the staff trained in EMDR. Um, and then I love learning. So I spend more of my time learning, creating content. We're finishing another foundational brand. We're wrapping that up to unveil some new stuff. You get to see our new logo right there,
Oh, I
um,
love it.
that I'm pumped about. Um, and then we're building our social media campaigns to be able to say like, okay, like we are normal people and we want therapy to be accessible for the normal person.
Hmm.
And so outside of seeing clients one-on-one, supervision, creating content, learning, and investing in marketing.
Awesome. That's amazing. And what would you say is because I see that you've got this passion for the building aspect, you
Yeah.
must have a big vision. I'm going off script here, and I know I haven't told you I was going to go here, but I want to
Yeah.
know, Adam, where
Yeah.
do you see your clinic going? Because we
Mhm.
don't always come across clinicians that have such a such a drive for the business aspect and for the
Yeah.
brand. And I see that you've got that. So where do you want to go? Where do you want to take it?
Oh man. Yeah. So man, the previous clinic I was at, I was in for almost 14 years. And so this
Wow.
business is still in its infancy. We're a year and a half old. Um, we still really are an infant as an organization. So right now it's filling out clinicians' caseloads. Being able to hire more people because of need. So that's kind of level one, is being able to get a couple more clinicians in here because of the marketing branding efforts are paying off and we're getting new clients in the door.
Excellent.
But then if we were to fast forward 5 years from now, I want to be creating more accessible content and be providing resources to people that maybe they are existing clients and they just need additional resources. Or maybe it's people that are not ready yet to schedule an appointment. And so, how do we give not just pop psychology, but good clinical psychological information that could later turn into a paying client? So that's where I want to be putting a lot of energy, is just providing hope and resources for
Oh, I
people.
love that. And I love that it's that you want to make it accessible wherever people are. That speaks to me because I know in private healthcare it can be expensive and not so accessible for all walks
Yeah.
of life. So that, I mean, as an ND, I really deeply appreciate that. That's
Mhm.
such an amazing vision. And I love your vision for teaching, that you've got this like mentorship model built into your clinic,
Mhm.
where as you bring on the practitioners, you're devoted to really getting them busy and supporting
Right.
them. We need more mentors out there. And I love
Mhm.
what you're doing.
Yeah, thank you.
So who has been a role model for you, Adam? Like who as a leader has really guided your vision and
Mhm.
inspired you?
Yeah, so I like to say I collect people. And I collect people because I can learn from everybody. And especially collecting people that are more successful, that are more financially better off than I am, that have built other businesses. Um, and so right now, the person that's truly inspiring me is a 90-year-old retired naval officer. He's in my Rotary Club, one of my community service efforts.
Oh,
So
wow.
90-year-old retired naval officer. His name is Tice Eiler, and he has this addictive disease called personality, where he's been through multiple wars, at like combat veteran. He's taught at the Naval Academy. He's been retired for over 50 years. And he's always encouraging people. He always has a smile on his face. Every conversation is worth the price of admission just to be in front of him. And so he's inspiring me just because of who he is because like he's a badass. And he could be putting all of his bravado out there. He could be like the Jocko Willink, the Joe Rogan, that if he wanted to be, but he doesn't put that off at all. He's like, what do you need? How can I support you? Like, what he's asking me, what's inspiring me so that he can learn from me. And I'm like, no, I want to learn from you. So, so
Awesome.
the thing I take away from Tice is be interested before being interesting. And so that's what inspires me.
Amazing.
Yeah.
Wow, it sounds like you do share a lot of qualities with Tice. I'm not surprised that he's one of your leaders.
Yeah.
Where do you I'm going to switch gears here. Where do
Yeah.
you, Adam, go to for
Mhm.
for leadership and entrepreneurial
Yeah.
lessons, courses,
Mhm.
inspiration, any of it? It might be podcasts, books, anything goes.
Yeah. So I've got a couple thoughts on this. First is I have a business crush on Cody Sanchez. I don't know if
Oh,
you've been following any of her work,
I
but
follow all her stuff. Yeah, she's
yeah.
incredible.
Yeah. So I have my on YouTube and podcasts like, where I get notified and get messages and just every Instagram post she posts, like it comes, I said it where like, let me know what she says. Um, and I think the reason why I really am just like learning from her is because like she could be doing something so complex with her background at being with Vanguard and doing international business, but she's really concerned about the boots on the ground in her community and the services that her community needs and equipping the normal person to be able to become a business owner and to be able to learn tangible skills to make them successful. And so again, another person that could be having all the bravado and success, but they're saying, hey, like let's let's demystify this process and let's give you the tools that you need to be successful.
Yes, and like let's look at the laundromat and break it down, right?
Yeah,
She talks about like the car wash. Let's look at
yeah,
those businesses and how lucrative they can be. I love that
right.
you brought her up because I think for clinic owners, it's she's such a great resource to look at because we can sometimes get caught up in like building a
Yeah.
company at scale when really there is so much. I mean,
Mhm,
profit margins can be very lucrative for clinic owners. We
mhm.
maybe don't have to have multiple locations. It could be just this one really like positive community influence.
Yeah,
And that's such a good reminder, right? We can do this. This can be lucrative as a lifestyle business.
right. And
She's smart.
then Yeah, and then my second thought is that I like to learn one standard deviation away from my clinic. I don't want to be in the echo chamber of learning from other clinicians as my only source of information because we're all thinking about the same thing in the same way. We're asking the same questions, giving the same answers. And so I always want to go one standard deviation away. And to be really honest, the place that I learn the most, it's a podcast called Making It. And it's a friend of mine I played in a band with, and two other guys that they've been on Netflix. They have very successful YouTube careers, and there are three makers. They're woodworkers, welding people, stuff that I have no capacity to learn how to do. I like my fingers. I have all 10 of them. Um, and they sit and for literally, they just celebrated their 10-year anniversary of that podcast. And all three of them approach problem solving differently. They're all three curious in different ways. They're very quick to say, I'm not an expert. I make my career of learning and failing and learning again. And so if people that are woodworkers, that are content creators, that are doing all the things, they're shooting video, making projects, editing, building businesses, feeding their families, and like I get so inspired and I learn the most from people that are I say they're one standard deviation away, but really maybe they're three or four standard deviations away. So I try to find people that are outside of what I'm doing because it takes away my judgments that I have on like what will work versus and now I'm just learning more about, okay, like what questions do I need to ask instead of what answers do I need to find?
That's brilliant, Adam, because we don't, I mean, I honestly believe that looking to other industries is critical for us because in private healthcare, back to private healthcare, but we
Mhm.
don't have a ton of successful
Yeah.
business models to look toward, right? As small scale clinic owners, and I know this firsthand as a clinic owner, I've tried to look for other clinic owners that are doing exactly what I want to do, and it's been tricky over the past 20 years to find them because we're such a small industry. And the folks who have really successfully done well in business have often been acquired or had multiple
Mhm.
locations. But those small scale, businesses
Yeah.
like Cody talks about,
Mhm.
they're often in other industries, the ones that have really made it. And so I think you make such a great point here, and I hope other clinicians hear you when you say that like you go that other, I love that you say a standard deviation away. I always like to say like look toward other industries when you're looking for like marketing inspiration or some brand ideas. But it
Yeah.
makes sense that you would do that because you've got to be curious about what everybody's doing in business. And
Mhm.
then you can be the leader in your field because there aren't so many folks doing it. So
Mhm.
congrats on what you've built. It's pretty
Yeah.
amazing.
Yeah. Thank you.
Yeah, thanks, Adam. I would love to open it up to some questions here.
Mhm.
Now, does anyone have any questions that we can open up? Please go into the chat and ask
Mhm.
away. I'll wait for folks to give us some questions there.
Mhm.
Adam, you mentioned the podcast. Can you say the name
Yeah.
of that again? What is your friend's podcast name?
Yeah. It's called Making It with
Making
Jimmy
It.
DiResta, David Picciuto, and my friend Bob Claggett.
I love it. I was going to
Yeah.
ask you for the names of
Yeah.
some of your favorite podcasts. Are there
Yeah.
any other podcasts you're listening to right now that you adore and you love to share?
Yeah. So I spend way too much time on the internet when I'm doing long runs, doing anything that is just like active. I have very limited time, and so I try to double whatever I'm doing. As a business owner, learning about the economy and finance is important. So on YouTube, there's a guy named Meet Kevin, Meet Kevin.
Okay.
And he is, again, one standard deviation away. His personality is electric. He's out there. He is a savant as a young 32-year-old guy.
Oh, wow.
Um, but he's excellent. I spend a lot of time listening to him. I don't always agree with his perspectives, but the way he phrases stuff, it gets me thinking so that even if I don't agree with him or anybody else that I'm listening to, like how a person analyzes something is really important. So I want to figure that out. Um,
I love it.
let's see, from a leadership perspective, I'm listening to a book by Stephen Covey, and about trust and inspire leadership. I can't remember the name of the book, but it's instead of leading from command and control, it's about trusting and inspiring. Um,
Awesome.
and yeah, and then other podcasts, Cody Sanchez.
I love that you gravitate toward the entrepreneurial approach
Yeah.
in terms of what you're listening to.
Right.
That's
Yeah,
great.
and then as a hobby, I do real estate investing, and so that's the one area of life that I feel like I can solve a problem in 90 days or less. And so I do listen to a lot of real estate investing podcasts. So
Amazing,
yeah,
amazing. From real estate investor to therapist. So my last question, I'm dying
yeah,
to know.
yeah,
I know that folks have called you the sex, drugs, and rock and roll therapist. Can you tell
yeah.
us where that came from and how that term was coined?
Yeah, so this was actually my introduction to Rotary, and I was asked to come speak at a group of a bunch of retirees at this community that I was getting ready to move to over a decade ago, where I live here now, and I'm still the member there. Um, and so they asked me to come speak for Veterans Day and for me to be able to, talk about PTSD. And so this guy that I was getting to know as I was getting ready to open the location here at the old practice, and so I'm like, all right, like give me the opportunity to meet people in the community. So they invited me to come speak, and so he was introducing me, and he said, "Yeah, I like to say Adam's the sex, drugs, and rock and roll therapist," and I had never even thought about that before. But as I was sitting there nervous, getting ready to speak, and he said that, I was like, actually, that's really accurate. I'm a certified sex therapist. I work a lot in addiction recovery. And then, yes, I was a musician, but I work with high performing people whose home life is crap. So that's the rock and roll piece. So, yeah.
Amazing. Thank you, Adam. That's
Yeah.
awesome. We do have one last question for you.
Yeah.
If you could give yourself, we've got a question from one of our viewers. If you could give your younger self one piece of advice, what would it be? And I would love to elaborate on that. Your younger self, meaning like the you who you knew wanted to go into counseling, you knew wanted to open a clinic, you knew you wanted to have a
Yeah.
thriving practice. What would that piece of advice be?
Do it.
I
Don't
love it.
wait. Don't wait. Do it. The Just to expound on that a little bit, like we are all gonna fail. And I had a former person I worked with that they accused me of being a ready, fire, aim person instead of a ready, aim, fire person. And so for a while, I felt like that was something I had to overcome, where I had to like reorient back from ready, fire, aim to ready, aim, fire. And that meant that there was a lot more planning to even figure out will it work. But by failing often, yeah, I just love embracing failure. By failing often, the failures are really small. So if I was going to start over, do it sooner. Like, be brave, make the mistakes, because if you fail often, you fail small. If you try to prevent failure, that means your failures are going to be even bigger later on.
Oh, that's so incredible. Thank you for sharing that. I share the same opinion there that we'll never find success if we don't have a whole bunch of failures under our belt. So
Right.
thank you for saying that so eloquently. Adam, it's been such a pleasure. Thank you for being here today and for opening your heart so wide to us. Thanks for sharing your story.
Absolutely. It's an honor to be here.
Awesome. Thank you. Thanks everyone for joining us. For more information on Adam, we're going to pop your website here in the chat. It's the Pursuit Counseling. And then Ginger Desk is gingerdesk.com. Great to have you here, Adam. Take care. Thanks,
Thank
everyone.
you.
Bye.